Hello guys, you are back with me, Dr.Shivaam Kesarwaani, and in this session I will again teach you some important stuffs regarding your DNB June exam and as well as the Neet exam. So stay focused and be with me for this 4 to 5 minutes. That will be very important for you. So I will start with the vegetations found in heart. So they can ask you this in different way. They can give one diagram and ask you what the pathology is, means what by seeing the diagram you have to identify the, by seeing the vegetation you have to identify the disease. So you must know the type of vegetation where it is found. So in case of rheumatic fever, small verrucous, these will be sterile and they will lie along the line of closure. I will show you it in diagram, but first listen it. Rheumatic fever, the verrucous lesion will lie along the line of closure of valves. So they will lie just along the line of closure of valves. For infective endocarditis, there will be large lesions, large vegetation that will be friable, and these are non-sterile, and they will be located along the chordae tendineae. Now they are going along the chordae tendineae. You understand? From the valve they are going along the chordae tendineae. Liebman-Sachs endocarditis vegetation, now they will be they are also sterile. They will be seen in most commonly in SLE, and they are small and located along the both the surface of the valve, above and below the AV valve. Understood? And they most commonly, but both the surface, but more commonly on the undersurface. So you have to learn it that it will be more commonly under the undersurface of the valve. Now in case of non-bacterial thrombotic endocarditis, this will also be sterile. So except the infective endocarditis, all other are sterile. So this NBTE, they will lie on the surface of the valve. Okay, so I will show you it with diagram so that you can have a proper understanding. So the first diagram is of rheumatic heart disease. They are lying along the line of closure of the valve. In case of infective endocarditis, they have gone into the chordae tendineae. In case of NBTE, they are on the valves, on the upper surface of the valve. And in case of Liebman-Sachs endocarditis, they are lying below the valve. Okay, so you can identify this now that these are Liebman-Sachs endocarditis found in SLE. The vegetations are lying below the valves, above the valves for NBTE, into the chordae tendineae for infective endocarditis, and along the line of closure for rheumatic fever. Okay, rheumatic heart disease. Now moving to the next important topic, that is cast in urine. Now they are very frequently asking about the stones, different urinary stones and different stones. So you must know about different stones and how they appear in urine. So they particularly asked in AIMS, they gave one picture, microscopic picture, and asked which type of stone it is. So this they may also ask about the cast in urine, because this is very similar and the future, you can say a future question. So you must know about Tams Hall protein. So what are they? They are basically formed in the loop of Henle and in the distal tubule cast, and what they do is they take the shape of the tubule. They are mostly the hyaline cast and are seen normally. So these are not any pathological casts which are seen in urine. Now if there are presence of RBC in cast, this makes it pathological, and the RBC cast is a pathology in glomeruli which is seen in glomerulonephritis, and they are isomorphic in urinary tract. Now WBC cast signifies inflammation. Now they either come from tubules as seen in acute pyelonephritis, also in pyelointerstitial inflammatory disease. Now if there is presence of bacteria in these casts, so this is the diagnostic of acute pyelonephritis, and it differentiated from the UTI. Because of presence of bacteria, we can make a diagnosis of acute pyelonephritis. Now what are broad cast? These are characteristically seen in chronic renal failure, also called as cast of renal failure. So you must know about these cast, and these are important also. Again, very important for this DNB, they ask different bodies. Although in this section I have named around 25-30 bodies, but you need to learn more, that I will finish it up in my next video, but in this I have selected some of the most important bodies which you must know and you must remember and you must revise. So Gamma Gandhi bodies, which are seen in chronic venous congestion of spleen, hemolytic anemia. They are basically composed of hemosiderin. They are result of dystrophic calcification and fibrosis. Now healthy bodies, you all know leishmaniasis, Heinz bodies, G6PD deficiency. Howell-Jolly bodies is hyposplenic states like in sickle cell anemia. So Howell-Jolly bodies in sickle cell anemia. LE cell in SLE, these are neutrophils and monocytes, and they are stained by hematoxylin body. Now Aschaff nodules in RF, asteroid bodies in sarcoidosis, ferruginous bodies very frequently asked in asbestosis. Again I am telling ferruginous bodies for asbestosis, I cannot name the exam. Councilman bodies is acute viral hepatitis, again very important. Samoma bodies are found in different conditions like papillary CA thyroid, serous cyst adenoma of ovary, meningioma, and many more conditions, and you must remember at least these three: papillary thyroid CA, serous cyst adenoma of ovary, meningioma. Moving to next, the Negri bodies, you all know, rabies. Do see the picture by googling the Negri bodies. Hirano bodies, Alzheimer's. Actually you should see all the pictures by searching it in Google, because they can ask anything related to the most important stuff. Now Lewis bodies in PD and Lewy body dementia, Parkinsonian disease and Lewy body dementia. Hirano in Alzheimer's. Pig bodies is lobar atrophy of brain. Verrucke bodies in schwannoma, Anthony A and Anthony B area. You should see the diagram. They have already asked in AIMS exam to identify the Anthony A and Anthony B area, and the diagnosis is schwannoma. Lafora bodies are seen in neurocutaneous lipofuscinosis. Civet bodies in lichen planus. CD diagram, important. Lichen planus, very important topic. Schiller-Duval bodies seen in endodermal sinus tumor, yolk cell tumor. Kohl-Exner seen in granulosa cell tumor. Michaelis-Guttman bodies seen in malakoplakia, which is an inflammatory condition caused by Proteus or E. coli infection of the urinary tract. The commonest site is urinary bladder, and these are basically basophilic inclusion inside the macrophages. So I will conclude my session of this high-yielding stuff with these. I hope you will do good in your coming exam, and always have your 100% confidence and give your best. You have got this time, and prove yourself. All the very best. Thank you.